Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the 9 p.m. live news edition. Here are the headlines. A new positive case detects a strengthening prevention and solicitation measures. With 8,200 dead, anxiety remains in Italy due to the COVID-19. Hello and welcome to our newsroom. The Secretary General of the Ministry of Health, Dr. Salah Banoita Turab, made a statement today on daily results of the progress of the COVID-19 on our country. The situation of the COVID-19 pandemic on the national territory remains stable. 20 people have been tested. One case was declared positive. The other 19 were negative. All these people are in a satisfactory state. No one needs special care at the moment. We would like to address these to the health professionals working in the field for case finding, screening and care. Their commitment requires our recognition but also our collaboration. We would also like to reiterate the importance of respecting the barrier measures in the imposing confinement that will not stop saying stay at home. And now faced with the sharp increase in the price of certain pharmaceutical projects since the emergency of the coronavirus pandemic in the Republic of Djibouti, the Ministry of Health and the Department of Trade have decided to investigate the prices of hydroalcoholic gels and protective masks. It was in this context that a mission from the General Inspectorate of Health Services of the Ministry of Health, whose objective is to ensure compliance with the pharmaceutical legislation in force in the Republic of Djibouti, carried out an inspection mission to private pharmacies. The objective of this joint mission was to evaluate the price of a list of pharmaceutical products sold in private pharmacies as part of the fight against COVID-19, following the increase in the price of certain pharmaceutical products such as alcoholic gel and protective mask. Health inspectors and controllers of the Ministry of Commerce requested the verification of the price of a list of 10 products. On the 40th day of general confinement in the country, the streets and the main arteries are almost deserted following the establishment of a law enforcement agency to monitor the implementation of general confinement and encourage citizens to stay at home and respect the measures taken to avoid unjustified gatherings and movements. Mobile outreach vehicles are crisis crossing the capital, as you can see in this image, mainly to encourage citizens to stay in their home, wash their hands regularly and meet basic or vital needs. The new device technology to fight the coronavirus pandemic in our country. Thus, since the beginning of the program of fight set up by the government, the Department of Communication of the Posts and Telecommunication has set up the toll-free number 1517 to find out how this cell is working. Installed the first floor of the building, the step in Djibouti. Our reporter Mustafa Ibrahim went to the scene installed in several offices of the first stage of the Djibouti Post Office building. About 10 operators are there to answer phone calls from Djiboutians who want to know a little more about the measures of protection against coronavirus. Telephone calls reach more than 2,000 to 5,000, and the operators who speak the national and French language and doctors are also there to better understand the symptoms of the callers. And now another subject from Balbala. If the confinement is respected in two communes of the capital, it is not the same in the commune of Balbala. Our teams who traveled this afternoon through this commune met in some places people who are still unaware of the danger and who are still keeping their habits. These are the video clubs where many young people are crammed. Our teams were even assaulted during this shooting. Collective games such as football or game of balls or something simple gatherings in the cafe in front of the houses. The images speak for themselves. As you can see, the community of Babala are not respecting the confinement measures. Now, moving on another subject, the measures taken by the government to close recreational areas such as beaches are respected to avoid the progression of COVID-19, of which 12 positive cases have been detected in our country to date. Confinement is respected, especially in the main roads where the security forces are presented, but it is less respected in the popular districts. These behaviors must change. The COVID-19, there are places where the containment is respected totally, like the beach that we visited this afternoon. Before the measures, these beaches were very frequent. The amateur swimmers of the weekend followed the measures of containment and remained at home, thus decreasing the risk of contamination. An example to be followed by the other category of the contrary to the other categories, of which some continue to practice the sport of the collective prayers in spite of the prohibition. Our population must change these behaviors and comply with containment measures by following the example of amateur swimmers who have stayed at home to protect their families and their surroundings. As part of the supervision of the preventive measures taken by the government of Djibouti to fight against the spread of coronavirus on the national territory, the management of the Ali Sabih Regional Hospital to carry out yesterday morning community activities of disinfection of cargo trucks, buses. Thus, in collaboration with the Djibouti Red Crescent Antenna branch of Ali Sabih, hand washing devices have been installed in all public places, such as the bus station at the Galilee border. The director of the regional hospital of Ali Sabih, Mr. Mohammed Suge Ainan, accompanied by the president of the regional council, Mr. Omar Ahmed Wais, the president of the Djibouti Red Crescent branch of Ali Sabih, Mr. Ismail Abouh, went to Galilee to see firsthand the good progress of the health control operation set up at the border and reinforce at the same time the capacity of medical team which is already on the spot. On this occasion, volunteers from the Djibouti Red Crescent Ali Sabih branch joined the medical team from the Ali Sabih Regional Hospital, which was already on the spot to reinforce the control and prevention measures at the border in Galilee. It should be noted that the health checks have been reinforced at the border at the Galilee, in particular the closure of the border to all passengers except for means of transport of goods and merchandise. And now another subject, the Djibouti Port and Free Zones Authority, which will put in place from tomorrow, Saturday, 28 March 2019, special badges for key staff working for transit companies for this year 2020, shipping agency, road hauliers and other transport auxiliaries. The staff of the companies whose list have been sent will have to come to the port offices for photo taking and printing of the badge on Saturday 28 March to Thursday 21st March from 10 o'clock to 16 o'clock. In order to avoid disruption, the port community may call the number 253-2135-6225 for assistance during the entire period of containment. And now, under the high patronage of His Excellency Mr. Mustafa Mohammed Mahmoud, Minister of National Education and Vocational Training, took place this morning an important official signing ceremony of an agreement between MENFOP and the International School of Africa. It is Mr. Mohammed Abdullah Mayoub, Secretary General, who initialed on behalf of the Minister the convention which relates to the acquisition of about 30 licenses for the use of the Zoom platform by the teachers of the Excellence School. The officials of the ISA are also committed to train teachers in the use of the platform in question. In his remarks delivered on the occasion of this ceremony, the minister stressed that today's agreement strengthens the partnership between School of Excellence and ISA, which exists since October 2017. The new director of the ISA, Mrs. Tricia Rock, was delighted to work with MENFOP on this pedagogical project, which should enable teachers to provide a virtual classroom that are dispensable at this time of global health crisis. She thanked the Minister and the Secretary General for their invaluable support in this project. Mr. Ayman, Director General of Sahara Global, also expressed his satisfaction with the good collaboration between ISA and the School of Excellence. He is convinced that the use of the Zoom platform will have an impact on the quality of teaching and learning at the School of Excellence. He praised the commitment of the Minister and his Secretary General in the implementation of this project. Moving now on the international news, the North fears that the official figures underestimate the real toll, and the South fears an explosion of the pandemic. According to the results published on Thursday evening, the pandemic has killed 8,200 people in Italy, with 662 deaths officially recorded in the last day, and the total number of positive cases has increased by a further 8%, the same as in the previous 2 days. These figures, according to many, reveal only part of the reality. Near Bergamo North, the worst hit Italian city, the municipality of Nebro, which has a population of nearly 12,000, has officially recorded 31 deaths attributed to COVID-19, explained Luca Foresti, a local medical official, and Claudio Consigli, the mayor in Italy, Corriere della Sera. The number of deaths under normal conditions should have been about 35, but this year we registered 158, that is 123 more than the average and not 31. The two men added they note the same anomaly in all the small municipalities with a number of abnormal deaths, 6.1 times higher than that officially attributed to COVID-19. The mayor of Brescia, another hard-hit northern city, also estimated that the contamination are much more numerous than was it said. The number of deaths is also higher because there are many sick people at home and we don't know how they are doing, said Del Bono. This is it for this edition. Thank you for watching us and have a wonderful night.